I'm Dr. Zachary Solomon. I'm a general medical dermatologist. What really drew me into medicine, I think, was kind of a natural choice for me. I grew up with my dad as an OBGYN, so I got to watch through him kind of the challenges and rewards of a career in medicine. And I think what really kind of tipped me towards pursuing medicine was just the simple things like going into the grocery store with him, and he'd run into his patients, they'd come up and say hi to him. I think that I really got to see the rewarding aspect of taking care of people and building relationships with them, which is what ultimately why I pursued medicine. I found dermatology just during medical school, doing rotations, and what I thought was really interesting about it is dermatologists really navigate different levels of the skin, so you can go from looking at somebody's rash in clinic to interpreting a biopsy, which is essentially analyzing how the skin looks on the cellular level. And then you kind of live in this in-between world where you're using specialized equipment to magnify the skin, use polarized light. So I think it's really neat to kind of draw information from all three of those realms to figure out what's going on and how to get people better. I think what's really important in building a relationship with a patient is just getting to know them. Because you can have the right diagnosis and a good treatment plan, but if it doesn't really work for them, or they're afraid of side effects, or they're not able to complete the treatment because of whatever circumstances they have, then they're not going to get better. So I think really having a discussion about treatment options and framing it in a way that's going to help you both find the right treatment is really important. Another thing that I place a lot of emphasis on is educating patients about their disease process, having people understand what's going on and really empowering them to take care of whatever condition they have. Over the last 20 years in our field, there's been kind of a dizzying pace of new therapies and medicines that have come out. So a lot of conditions that before were really hard to treat, things like atopic dermatitis, psoriasis, even vitiligo, we now have a lot of really safe and effective options. And there's also been a lot of innovation in the topical therapy space. So I think it's a really exciting time for our field, and there's a lot of good options for patients. You know, I think part of being a doctor is just going on the health journey with patients. What's really rewarding is just being on their team and kind of helping them to get better. That's really, I think, what kind of fills my cup and brings me back to work every day. It's just seeing them get better and just enjoying that with them.